Welcome to this episode of the Clinical Podcast Series brought to you by the American Academy of Optometry Foundation. Today's episode is the efficacy of topical azithromycin versus systemic doxycycline in the treatment of Meibomian gland dysfunction. My name is Kaleb Abbott. I'm an optometrist and an assistant professor of ophthalmology at the University of Colorado School of Medicine, where I practice in the dry eye clinic. And I'm joined by Dr. Anna Tichenor, who's an assistant professor at Indiana University and the director of the dry eye clinic there. We are excited to have her join the podcast today and are looking forward to reviewing an exciting and clinically relevant topic today. So Anna, can you explain why this topic is important?
Hi, yes, thank you. And thank you for having me today. So I really like this paper because, a lot of our patients have some degree of Meibomian gland dysfunction, especially, of course, in our patients with dry eye disease. And when we think about MGD, we really sort of have two factors that are kind of at play. So we've got meibum that is kind of stuck inside of that gland, inside of those glands, probably due to a thicker kind of consistency. And so we really get a decreased output of meibum onto the ocular surface, and this can then lead to increased bacterial growth on the eyelids, which can then ultimately trigger inflammation. So we really need to understand what kinds of treatments are going to be effective in both plugging those glands, unclogging them, and reducing the inflammatory and bacterial overgrowth on the eyelids.
Exactly, well put. So what was the purpose of this study?
So in the past, oral doxycycline and oral azithromycin have really been looked at in terms of efficacy in MGD. However, this study wanted to look at oral doxycycline compared to topical azithromycin in treating and managing patients with MGD.
Mm-hmm. And how was the study conducted?
So patients were enrolled in the study who were symptomatic, so they had complaints, and they were evaluated to have MGD. So those were the patients that were enrolled in the study. They were then randomly assigned to one of two treatment groups. So group one was assigned the topical azithromycin, which they were using twice a day for 4 weeks. The second group was assigned oral doxycycline at 100 milligrams twice a day, again for 4 weeks. And they performed follow-up appointments at 2 weeks and 4 weeks to really look at outcomes in terms of evaluating patients' pain, discomfort, and looking at eyelid margin telangiectasias indicative of inflammation, as well as looking at tear film breakup time.
Ah, yeah, very interesting. Yeah, there's a lot of patients that I have on antibiotics for their treatment of Meibomian gland dysfunction. Personally, I don't feel like I use 100 milligrams of doxycycline twice a day. Is that a higher dose than you typically use, or is that about what you're using?
So if a patient really has really symptomatic and a lot of inflammation in those lids and really kind of clogged glands, I will typically start at that higher dosage, and then eventually for maintenance, once we start to see some improvement, may reduce it down to the 50 milligram dosing.
Yeah, very interesting. And so what did this study find when they were comparing the topical azithromycin to that oral doxycycline?
Yeah, so at that initial follow-up, which was at 2 weeks, the azithromycin, the topical applied azithromycin, kind of came out on top in terms of alleviating pain and discomfort sort of quicker than the doxycycline. And it also seemed to improve that tear breakup time a bit better than doxycycline. Then when they did the 4-week follow-up, so after 4 weeks of use, they sort of kind of even out in terms of pain and discomfort. So both azithromycin and doxy, those patients that were taking those medications, they kind of reported similar sort of improvement in overall pain and discomfort. But the azithromycin group seemed to really come out more on top in terms of the ocular surface signs of improving that tear film stability. So the tear breakup time was still higher in that azithromycin group than the doxy group, saying that, that topical application may have a better effect at, addressing the ocular surface and the tear film and improving that.
Mm-hmm. Yeah, when I was reading the study, it seemed like the benefits with topical azithromycin is that it actually worked a little bit quicker. And then in the grand scheme of things, in the long run, improved the tear film metrics a little bit better than oral doxycycline.
Yeah, for sure.
So what about side effects with these two different options, topical azithromycin and oral doxycycline. Can you speak to that?
Yeah, and I think that's where this is sort of comes into an interesting play, right? So, kind of the things that you would think about. So with the topical azithromycin, patients did have some burning reports and sensations when they were applying the drop that was higher than obviously than the oral doxycycline group. But those patients that were taking the oral doxycycline did have some GI upset that you would expect. So definitely have some differences there in the side effect profiles of these medications to consider when deciding which one might work better for patients.
Mm-hmm. So after reading the study, does this change the way that you're thinking about the use of antibiotics in MGD patients or the recommendations that you're going to make to patients?
Yeah, certainly. I mean, it's clearly showing that azithromycin applied topically can work just as well as doxy in terms of reducing discomfort, but also may even work better in terms of improving that stability of the tear film. And when you look at those side effect profiles, and we're getting a better understanding now of our gut microbiome and how oral antibiotics can affect and have a role in that, even at those low doses. I may be leaning more towards using some topical options like topical azithromycin in patients with MGD, for sure.
Mm-hmm. Yeah, I totally agree with you there. Any additional relevant take-home points for our listeners?
I think that, certainly kind of we need to have a better understanding of the role of inflammation in meibomian gland dysfunction. So we're using these sort of antibiotics in terms of their anti-inflammatory effects and somewhat also perhaps reducing that bacterial load on the eyelids that can be influencing the quality of that lipid coming out, the meibum. So we need to really have a better understanding of how inflammation, the role that it plays in MGD and really how it develops. But overall, it seems to be effective. Both topical azithromycin, again, seems to come out as being effective in helping these patients.
Well, wonderful insight. We really appreciate you joining the podcast today, and we will see everyone at the next episode of the Clinical Podcast Series. Thank you.
Great. Thank you.